Hi, I'm Mary Dillon. I'm the Executive Chair of Ulta Beauty, and I am thrilled to be here today with Roz Brewer at the International Women's Forum Hall of Fame Awards. And I'm excited to have a little chat with Roz, so thank you so much for having me do this. I'll just say that this is an honor, and I've known Roz for a while now. I've known her as a business leader and gotten to know her a bit as a friend, as a fellow mother, and it's just really exciting to see her in this new role and winning this amazing recognition. So I have a lot to cover with you, Roz, if you don't mind. But I want to start with, let's just start with where you are right now, okay? So you're more than 6 months into your role as the CEO of Walgreens Boots Alliance, a wonderful Chicago-based company. You know, I'm a Chicagoan, so I was so thrilled to have you join this lovely city. But let's just talk for a minute about what's it like to come in as a CEO of a Fortune, I think, 19 company. Yes. How do you get started? What have you been focused on?
So first of all, Mary, thank you for joining me at this moment. And you're right, it's a fantastic company, very Chicago feeling. I'm glad to be back in the Midwest. You know, I'm from Michigan, which is right across the interstate there, so this is great. But coming into a company at this point in time in our country during a pandemic, I want to remind myself to never do that again, right?
And note to self.
Note to self. But having said that, it couldn't be any better, because right now I get a chance to see the company when it is in a midst of a real crisis, right? And so that's when everything shows. And you see the vulnerabilities in the company, you see opportunities, but then you also see your team at their absolute best. And I've been just fortunate in that way. I see people who are really pushing to administer vaccines to communities that would not have that opportunity if it weren't for this company. I see us, our pharmacists, stepping up and becoming such an authority in their communities and leaning, you know, towards people who need them the most. And then I get a chance to have a say-so in this ever-changing world around healthcare. And healthcare needs a reimagination right now. And so I'm glad to be in this role. I hope I can play a part in this transition in this country and globally around healthcare.
That's great. I know we'll dig into that more as well. I promised Roz, if she didn't mind, I also wanted to take a step back in time. Okay. And one of the things that I think we share in common, we're born around the same time in the Midwest. I'm from Chicago, you're from Detroit. Yes. I believe we're both first generation college graduates.
That's right.
And actually I've been working since I was, you know, probably 13. But the first job I had with my name on a paycheck was actually with a competitor, Osco Drugstore here in Chicago, where I started out in the candy and tobacco department and then moved into cosmetics. So there was a light to come, I guess. But you know, putting myself through school, all the things that one does, I really like to focus on that part of people's story, like your story, because it's still pretty rare, I think, and it still is inspirational for people to see what's possible. So if you don't mind, I thought it'd just be interesting to just know a little bit about your mindset growing up and what kind of ambitions you had. People often ask me, did you think you're going to be CEO someday? I'd be curious how you would answer that question.
Never, ever thought I'd be CEO one day. But you're right, Mary. Grew up in Detroit, Michigan, youngest of 5 children. My parents did not go to college, so my siblings and I, all 5, first generation in our family. And we knew nothing but hard work ethic, because my dad worked 3 jobs. My mom worked when I was 3. And I often talk about being a latchkey child at 3 years old, because my mother returned to the workplace when I was 3. And there was this time frame when my older siblings were at school and my mom had to leave because she worked the afternoon shift. So she'd stand me on the couch in front of the window, told all the neighbors to watch me, and they did. They would yell, "Don't get down off that couch." And so I'm in the window like, you know, like a toy until my siblings came home 5 days a week. And that probably went on for a couple of years until I started kindergarten at 5 years old. So that was my beginning. And just like you, my first paycheck was when I was 16 years old. I worked in retail at a men's boutique. I got the job through one of the city programs called CETA, where they assigned you to where you would work. And I went to Cass Tech High School, which is a downtown Detroit vocational high school, and I would just go to work after I got out of school every day and then take public transportation home at night from downtown all the way to Northwest Detroit. And so I think that hard work ethic from my dad, to me starting my first job at 16 and working every day since then, has really just impressed upon me the ability of hard work ethic, and appreciation. And I think that's what makes a difference, because when I envision my mother catching public transportation in 12 inches of snow so that I can go to college, I get up really easy in the morning. It's really easy for me to wake up ready to go.
That's incredible. I didn't know a lot of that about you, so thank you for sharing that. And I think so often people look at somebody like you and don't realize how hard you had to work to get where you are. Your parents should feel proud, but also, to me, it's like it's the story of what's possible in America.
Absolutely.
I think that's just really cool. So thank you for sharing that. And I also know, talk about your college years, and you decided to study math and science. So that's great that you were good at that. Talk a little bit about how you chose your university and the opportunity there, as well as what you studied.
Yes, so at the time, I was the last one of my siblings to go to college, and my sister next to me was in pharmacy school at the time. Ironic that now I work for Walgreens. And it was interesting because my sister had to help me apply to college, but it was my high school guidance counselor who talked to me and said, you should go to Spelman College. It is, a private all-women's college. It's in the South. You get to leave the city of Detroit and venture into something new, and she really talked me into it. And I did not apply to college until late spring, which couldn't happen today.
Yeah.
And I was actually a chemistry and biology major in high school. So when I came to Spelman College, I was a chemistry major at Spelman College. So a lot of transferable skills. I was science and math. And, just to leave the state of Michigan was really wonderful for me, and I was the first one to leave of the 5 of us.
That's incredible. And I know, having seen you in our time at Starbucks when I was on the board, and you had a leadership position there, your analytical skills, all the things that you probably learned in college, how does that play out for you in business today? Tell me more about that.
It absolutely does. So, Mary, you are always probably stretched into these, complex situations. These jobs are not easy, right? And nothing is ever as it is until you dig into it and realize the complexity of it. So the analytics are really, really critical. Never really understood how my chemistry degree would work for me, but being able to problem solve, look at the problem, break it down, and then there's this piece around communicating and helping other people understand the problem. And then so that we can get on the road to solutions. So I think that has just stuck with me. My favorite courses were organic chemistry. I liked physics. I did well in math. And so that whole piece around data has been exciting for me to see where data and analytics is coming into play into everything we do.
And it's so important in everything we do.
It's so important.
You may be
in
one of the
everything.
only people I know who have ever said that they loved organic chemistry. So
Really?
file that one away. That's good. That's great. So let's step back then, because you started to talk about this a little bit. We talked about your current exciting role. So talk about the role of purpose. I know you've talked about purpose as a driving force in how you make decisions. Maybe talk about how it led to your decision to come here and be the CEO of Walgreens Boots Alliance.
Yes, so Mary, you and I share our experience at Starbucks together, which is a fabulous company. I was having a fantastic time, and lo and behold, we're in the middle of one of the biggest conundrums in the world right now with the pandemic. And I will be honest with you, a lot of soul searching happening during that time for all of us. And for me, just to see, and I was beginning to learn, as all of us were, how is COVID impacting people, right? And so initially, the disproportionate impact on people of color blew me away. Blew me away. Sleepless nights, just thinking about how could this be. This is just as when the AIDS pandemic of the 80s, it hit first, the African American community, same here. So it just puts a spotlight on access to health care, both cost-wise, physical, virtual, access to health care. It also speaks to what makes us be in unhealthy communities, right? What is that? And I had done some work when I was with Walmart around food deserts. And I began to think about food deserts. I was thinking about, well, we have coffee companies, coffee stores in these places. Why don't we have Walgreens? Why aren't we, in the communities? And so our physical stores at Walgreens and Boots are in the right zip codes. But this gave an opportunity for something different. So when the opportunity came to me, I said, you know what, I'd love to play a part of this. I've had all the fun jobs, I've had the big jobs, I've had the serious jobs, but this one is one where I could come and throw everything I possibly can at it. Work with such a great foundation. The history of Walgreens always amazes me. The combination to Boots and all the work that's been done in the UK, a global entity. So it was exciting for me and a chance for me to look at purpose in a totally different way and to impact it just by sheer focus and being deliberate and intentional about making change happen for access to healthcare, both affordability and access physically.
Wow. And what a gift to be at this point in your career realizing this is the perfect culmination of bringing these experiences and your interests together. And I know that everybody in Chicago, like I said before, let out a cheer when we heard that you were going to come and lead this great company.
Nice.
So super cool. Okay, so we started to talk about this. I know this is on your mind all the time, but you have a strong voice as a CEO. We all have strong platforms. So, and especially now that you're in healthcare. So talk more about how you are using your voice and your platform to address inequality, especially in healthcare.
Sure.
Maybe you can share more with us.
Sure. So first and foremost, you know, I think that our team that was responsible for vaccine administration, we made sure that we brought vaccines to the people that needed them the most. So we created mobile clinics. We also created a hub and spoke method in terms of how we manage the vaccines themselves, right? And so when we knew, for instance, the Pfizer drug, we knew that it needed certain care in terms of a cold chain. And so we created a cold chain process so that we could distribute broadly to stores quickly. So those were some of the things that we did with great intention. But I would also tell you that we have an opportunity now, as we speak very consistently to Operation Warp Speed, our team in Washington and the administration, about not only vaccine administration, but I always take that next step and begin to educate them and help them understand what things cost, right? What does it take to build a labor solution to the things that they're asking, so that when it's time for us to really get under the covers on what's the real cost of healthcare, I want them to see that at Walgreens Boots Alliance, we understand. We're going to do everything we can to reduce our costs so that when our costs are passed on to the patient, we're playing our part, but also to work with this administration, because it's going to take more than just the public sector. It's going to take public plus private. This is a big issue.
As we're seeing, yes.
It is a big issue. And so I think developing those relationships, that's one thing that I've always done, is to make sure that I kept relationships in Washington. And so I'm using some of those relationships now to have a voice around our views as a company on healthcare. And it is about access and cost reduction.
Yeah, and your timing is kind of incredible, because I remember stepping back and thinking about the challenges of, like you said, the supply chain and the people, impacts of all this. But I was proudly vaccinated at my local Walgreens, I want you to know. So, and very happy with the experience.
Awesome.
So, yeah. So that's probably a pretty good pivot to thinking about as a CEO, especially in this complex time and in this complex industry, you have a lot of different stakeholders, right? So curious how you think about the balance. So whether it's your employees, whether it's your consumers, government, investors, there's a lot to balance. So maybe talk about some of your thoughts on how you balance all of that.
Yeah, so first and foremost, I immediately think about our frontline workers, because they manage a lot. Either you're walking into our physical stores, and the front of store has one opportunity, the back is pharmacy, and then we're creating some wraparound services. But what's important to me is to make sure that the people that work the hardest for us understand where we're trying to move the company to, and to understand that they're valued. We just moved to $15 an hour for our minimum wage. We're getting there over a period of time. I think that's important. I think, secondly, after I consider, all the decisions that we make and the impact that it has on the people who work the hardest for us, I begin to think about our communities. And so when you walk into one of our buildings, you're either coming in for something from a beauty standpoint, which is also healthy for a great mindset, but also, too, many times people walk into our units just having received probably some of the worst news. And they'll leave their physician's office and walk into a Walgreens for a prescription or Boots, and they realize, I don't really understand, right? And so our pharmacist becomes an authority at that time, but they also become a friend, because it's in a different environment. It's in a setting that they know, I'm going to see this person pretty regularly now. And so I think we have an opportunity to extend ourselves to our communities much stronger, and we're doing that. And then the third, I think that, I have been having conversations with like-minded CEOs that I think if we could arm together and create a position around quality of healthcare, I think that is another constituent, Mary, that I think is really important.
That just gave me goosebumps. Your insight about the human aspects of what this is about. I mean, honestly, I could really relate exactly to what you just said. And so you can be walking into a Walgreens, and the importance of the role of the pharmacist is just something that I just think you really put a good light on, something that is a really great human insight and a great guiding light as you think about the role that you play, among others. So thank you for sharing that. Sometimes people ask me, if you were to go back to your 18-year-old self, what advice would you give yourself? And I'm curious how you would answer that. And I'll tell you mine.
I actually wish I would have partied a little harder.
Take that off the official record. No, I'm teasing you.
Just because, life gets serious later, and I enjoyed my college years. But, I think I don't regret anything, really.
That's cool.
And I also see the building blocks. I see how things tie together, and how, maybe my simple assignment early on when I was working in that men's boutique early on, that was my first entree into retail, right? So you never know where things are going to take you. So I have no regrets. I look back on it and say, I learned something everywhere I was able to be.
That's really cool. When people ask me that question, what would I tell my younger self? It's the same thing I tell my older self. Stop being so hard on yourself.
Yes, that's
it's
so
like,
true.
and I give that
that's
advice
so
to many young women as well.
Yes.
Anyway, so let's maybe wrap up with a question about your legacy, which I know that's maybe, you're very modest and humble, but I'm going to put you on the spot. What would you like to see as your legacy as a business leader, Roz?
So, let's see, I haven't thought much about that, only until recently, I will say. I really hope my legacy is really wrapped around this transformation in healthcare. I think this could be the most transformative change that I could ever impact in my entire life. And it's so meaningful, right? Because it affects everyone. And it's universal, it's game-changing, it's life-changing. And I just think if we could just figure out how to reduce the cost of healthcare and take the quality up at the same time. We've all been posed with that problem, cost and quality. This one, we need both. And we need access at the same time. And I think if I can play a part of that, that would be the wonderful legacy that I'd love to leave.
I will applaud you all along the way on that. That's fantastic.
Thank you.
So thank you, Roz, and congratulations again.
Thank you, Mary.
You're welcome.
Thank you.